And it is wonderful to be back again. Some of you might have been able to join us for our first session roadmap to dementia diagnosis last month. So anyway, welcome everyone, and thank you for joining us. We are so grateful to have so many people here. My name is Nancy Koppelman, and I'm the co-director of outreach at the Center for Alzheimer Research and Treatment at Brigham and Women's Hospital. Today, we will present the Q&A for the second Roadmap to Research Participation. A little background, the Roadmap series is a 4-part comprehensive program about aging and memory. The series is a culmination of a couple of years pulling materials together in being in the community and at neighborhood health centers. People and clinicians asked us to prepare this to help guide those people walking this road. A few details. You should have all received your electronic companion guide for today's program. I did hear that one person hadn't, so I will send that. And if you haven't, please email me and we'll send it to you. We will also send you an evaluation form for today's program, so please complete it. And as we value your feedback, and sign up to join our education registry. So I would also like to introduce our speakers today, Nicole Chan and research participant Art Cantor, who I'm still waiting for him to join us. So hopefully he'll get in soon. So Nicole is the project manager at CART. She has worked in research for Alzheimer's clinical trials throughout her professional career. Nicole has been at CART since 2014 and continues to be inspired by the opportunity to partner with all of the dedicated research heroes and the opportunity to be an integral part of a highly motivated team and the cutting edge initiatives at CART and its affiliates. Nicole has a BS in biology from Tufts University and is currently pursuing an MBA with a concentration in health sector management at Boston University. Art is an A4 study research hero at CART. Prior to his retirement in 2012, he had a robust professional career. Art's early positions focused on the elderly and health. Afterwards, he directed several, including the VNA of Massachusetts, the Mass Lodging Association, and the Association of Strategic Alliance Professionals. Art's mother lived with AD before passing away in 2018. Art writes and speaks Spanish when not at CART. Now I'm turning it over to Nicole and Art to answer your questions.
All right, I'll start. So hi, everyone. Thank you so much for having us. I know you had the chance to meet virtually our colleague, Dr. Rentz, in the previous session, and I'm excited to be here today to talk to you more about what our team and I work on the research side. So I can start with a brief summary to kind of refresh from the presentation that we did have. So we are a large team that spans across both Brigham and Women's and Mass General, and we work on a lot of different types of research. And with all of these, we are continuing to learn more about what aging looks like in the brain and developing assessment tools, because quite frankly, there's still a lot we need to learn because the brain is just so complicated. And we're also focusing on trying to slow down Alzheimer's disease progression and even prevention before any memory symptoms. And we're driven by the urgency now because we're all living longer, which is great. But the biggest risk factor for Alzheimer's disease is age. And what our program focuses on are observational studies and clinical trials. And both of these, your participation in either of these are at no cost, and it doesn't go through insurance. And for most of them, there is compensation for even participating. So to kind of go into the two different types, the goal of observational studies is to find new tools to detect and track the disease. A lot of the procedures involved can vary depending on the study, because the structure of observational studies do have a wide variety, but the procedures can include memory tests, they can include vital signs, EKGs, blood draws, MRIs, and PET scans, which are common for Alzheimer's studies. And the frequency and the length of study varies a lot as well. So for example, we have some that are just a couple visits in the span of a couple months, to some observational studies that are more frequent visits in a couple of years. And on the clinical trial side, the goal of that is to find new medication that can slow down memory decline in patients with memory loss, or the direction the field is focusing now on is prevention, which is finding a new medication that can prevent the onset of Alzheimer's in cognitively normal individuals. The procedures in clinical trials are similar and can involve memory tests, vital signs, EKGs, blood draws, MRIs, and PET scans. And the main difference is that there's a research medication involved and usually requires more regular visits, because right now the medications out there for Alzheimer's disease are mainly administered by infusion or an IV. Studies are often monthly frequency for a minimum of 1.5 years, and some studies can be up to 8 years long. And for all research, we start by explaining the details of the study prior to anyone signing up. These details are included in informed consent form, which is a very detailed document that goes into all of the risks and everything that we know about, like the memory testing involved, the drug, if there is one involved, and it is reviewed with our study physicians. And even when you sign the document, know that you're able to withdraw from the study at any point, because research participation is completely voluntary. All the data that we collect are kept confidential and de-identified, so the results don't go into your medical record. And if you are found eligible for any of our studies, regular visits can include the procedures that I just mentioned, and can vary from at-home mobile testing visits to in-person drug administration visits. I also do want to note that specifically for clinical trials, which is the group that I specifically work with, we are constantly assessing to ensure that you're safe in your participation. And we have a team of study clinicians that include neurologists, physician assistants, nurses that review your clinical assessments. So we always do prioritize safety over research. So those kind of wrap up the key points about research, and I'm happy to dive deeper into any of those details later on in the Q&A session. Now I'll turn it over to Art Cantor, who I've had the pleasure of knowing and working with for, I think, almost 6 years now. And I don't know if I've ever said to you, Art, but you were one of the first participants I met when I started working with this group, and it's just been such a pleasure. And I'll turn it over to you to talk about your experience.
We need to unmute. Oops, asked to unmute.
Art, if you could just approve the.
I've got it.
There we go.
I wanted to share with you the genesis for my participation. In the 70s, I was running a large elderly service program in Chelsea and Revere. And while I was there, my grandmom, who lived in Chelsea, got diagnosed with arteriosclerosis. And at the time, it seems that a lot of older people who are suffering dementia were diagnosed with arteriosclerosis. It frustrated me as someone in elderly services that I couldn't do anything about it. Later on, my dad passed away in 1997, and he had a slight type of dementia when he died, but he had not been diagnosed because he was suffering another type of diagnosis. He was dealing with another type of diagnosis. And then finally, my mom, in probably around 2010, we started seeing some strange behavior. And we had her diagnosed, and she had Alzheimer's, and sort of that led to me, my journey anyway, of retiring and then managing my mom's care with my sisters. But probably, maybe 6, 7 years later, or not later, but shortly thereafter, it's probably around 2012, when my partner gave me a brochure that talked about a study called A4, and the study was about Alzheimer's. But interestingly enough, I had just retired. A company named Eli Lilly was on my board of directors, and the drug that they were using for this experiment was a drug I had heard about from my board member. But anyway, I had decided to do this because I thought, if I do nothing, I can just stick my head in the sand and let whatever happens happen. But I'd rather be connected to the research community and participate in a study that could not only benefit me, but benefit other potential family members. So that was my genesis for doing this. And it started out as a double-blind study. And I've been, I think as Nicole said, I think I've been doing it for probably about 6 years. As far as being a subject, if you will, it is amazing for me. They might as well they do everything they can to facilitate your participation. In my case, I live in Roslindale, but to be able to go into one of Brigham's buildings, have the parking taken care of, immediately going up, and of course, everybody is following the appropriate social distancing and pandemic regulations, if you will. And it's just 1, 2, 3. They make it very easy for me. And so I'm very pleased 6+ years later that I'm still participating. That's it.
Thank you so much, Art and Nicole. I am going to spotlight both of you, and I'd like to open up the questions to everyone. You're welcome to unmute yourself and ask anything that you would like. There's nothing out of bounds, and feel free to just unmute yourself and talk. You don't have to raise your hand or anything. If you want to be anonymous, you can chat your questions to me and I'll ask them anonymously on your behalf. And while you're thinking, I'll get started with one question that someone emailed to me, which is, how does one volunteer to participate in observational or clinical studies?
If someone is interested, I'm happy to share my contact information, and we would get the process started there. So what would happen is I would connect you with one of our team members who would talk to you over the phone, kind of give you more details of what the video kind of went into about the pre-screening process. There are a couple steps that we need, but we do talk you through everything before you even commit to the study. So as you can reach out to me and I can share my contact information.
Okay. And what is the difference between a clinical trial and an observational trial?
Very good question.
Sure. I can kind of delve into that. So like I mentioned, clinical trials do involve a medication, and the goal is to slow down any memory decline if there's a patient who has the diagnosis. And for Art's case, he joined our prevention study, so it's hoping to prevent we're looking at hoping this medication will prevent the diagnosis, versus observational studies. There's similar procedures in terms of memory testing and scans and everything, but there would just be no medication.
Shlomi, go ahead, please.
Okay, thank you. My question is, when you speak of observational studies, does it involve like brain fitness training and such, or it's just the research and this is it?
Does it involve what?
like brain fitness exercises and so on?
Yeah, so that's kind of that's what we call like memory testing, where there are questions that so they often include kind of like asking you a list of list of words to remember. I'm sure I see Art nodding. We have some that have faces that we show you that you have to remember their names to. We have some where you have to kind of name pictures of objects. So that is involved in both observational studies and clinical trials, because that's just one of the tools that we use in the Alzheimer's field to track, you know,
Progression.
yeah, progression, exactly. And Art, you can chime in about your experience with that. It's not always everyone's favorite.
Yes, the question I have is, I realize that for testing, to know where that person is, what category you would put them. But the question is, yes, you have different categories of, let's say, development of Alzheimer's syndrome. Now, is there, okay, the way I am looking at whether certain group that you feel that they are, pretty good, whether with exercises, and it's like on a regular basis for a certain period of time to see whether that makes a difference, whether it stops or even improve the person's condition. Because as I understand, our brain is elastic. It has elasticity to it. So if you, just like with the physical exercises, we have it at to keep our, in good shape physically. Whether this program also have a program where it is really working with people for a certain period of time to see whether, we can halt, not medication, but with brain training and so on. Do you have something like that?
Yeah, that's a really great question. It actually would be considered a clinical trial, actually, because I guess the definition is clinical trials, any intervention. So exercise, diet, that's included. So we do have one collaborator who is running. Actually, I'm not sure if he's still actively enrolling, but there is a study available where he is looking at exercise. Mediterranean diet is something that's been researched about to hopefully kind of see what that does in the brain. And even if his study might have closed, I know we are always we work with so many different neurologists, even if they're not in our group, that there's a way to connect with that. So that's a type of research that you're interested in. We can definitely talk about that in the first phone call, and we'll find that study for you.
Thank you. There is one more. And again, especially now because of the pandemic, okay, I think our psychological state of mind, okay, has an influence on that, the issue of sleeping enough and so on. So what I'm thinking about, that is a comprehensive program where it involves mindfulness, nutrition definitely, and so on, as I mentioned before. Do you have a program like that?
Yes, we do. So we have clinicians who focus on more of the psychiatric side as well. So there definitely are studies that look more into maybe even anxiety and how that relates to memory. So when I say we collaborate with our MGH partners, a lot of those studies are over at our MGH side. And there are studies available. And I was stressing on memory testing, but a huge part of Alzheimer's research are also questionnaires. So that's where, people give feedback about their stress levels about the pandemic or any other things. We might actually have one study that has to do with sleep as well. We do have a sleep neurologist on our team. So yeah, they're definitely, we're trying to understand everything about what contributes to Alzheimer's. So that is a very great question.
Yes, it's like but I guess I might be repeating myself in different. I'm looking for a holistic approach.
Yeah.
Isn't just and definitely not medication.
Right, right. So for the sleep studies the studies that involve, I don't think there's actually a sleep study involved, but where you'd have to go in and sleep in the
Yes,
clinic.
yeah.
But there are studies that we have a neurologist that focuses on what sleep does. I actually am not as aware of one that kind of combines all that. I know we do have one that focuses on exercise and diet, and then a separate one about like anxiety, like depression, even, and memory loss, and then a separate one about sleep. I don't think I've seen one kind of combining those yet, but
Well,
that,
maybe this is something good to suggest.
yeah, no, I think that's great. I think they might have not gone, at least our group might not have gone that far yet, because we might have to see what those individual variables do first, and then, you know, maybe in a couple of years, I don't know. I don't have a PhD in that, so but that's my kind of understanding, maybe why we might not have one that's as holistic as what you're describing, but we definitely have ones that are not medication focused, but looking at other types of intervention.
Thank you.
Yeah, thank you.
I am going to unmute the one person who did call in just in case they do want to ask a question. But in the meantime, how long do study visits last?
Yeah, they can
I'm going to answer that.
they can definitely vary, right? I think for at least like the study ARTSN, the shortest visit is about like an hour long, and then the longest visit for that study can last like 3-4 hours.
Well, actually, it's less. It's closer to 2, Nicole.
Okay.
With the cognitive testing and everything, it's probably a little over 2 hours.
Great, thank you. And for some of our observational studies that are a little less involved, those can be much shorter, where they're actually even done at home. So it would just be kind of like a 1-hour virtual testing session you're doing at home. But we do have some other studies that the longest visit we have does range like closer to 5 hours, just because they have more comprehensive memory testing. But we kind of have all of the range. And then in terms of the frequency, also depends on the study. Like I said, there's some that could only last a couple weeks, a couple months, and then several years.
Thank you. One participant asks, I know that people tend to volunteer for studies if they have a history of Alzheimer's disease. Are you also looking for volunteers who do not have any family history of Alzheimer's disease?
Yeah, absolutely. Most of our studies don't actually require that. For the ones that do require a family background, it's usually because it's a younger age range, and it's just finding that there's a higher risk for younger individuals to you know, have the risk of developing Alzheimer's if they already have a family background. But in general, that's not a requirement for any of our studies.
Just to understand, so what you're saying that the study, okay, the research, you have to have the beginning or just someone curious, you know what I'm that still functions very well. And so what are you looking for your study?
Yeah, so we have a range from looking for people who have no memory diagnosis, no Alzheimer's diagnosis, and then we do have some studies that we do look for people who have a diagnosis, and for those studies, which can either be with medication or without. We do need help with both of types of studies with people with a diagnosis, to just kind of see, for the observational study side, to see if there's no medication intervention, what happens with the brain. And then for the ones that we do have a medication for people with a diagnosis, it's hoping to slow the memory loss. But yeah, we also look for people who don't have any memory symptoms.
Can you explain about the diagnosis? You said people come with a diagnosis of maybe some memory loss, medium, or maybe even more extreme memory loss. Who does that diagnosis? Is it someone on your team, or am I supposed to come in with a diagnosis from my own neuropsych?
Sure. In our previous model, it was kind of having already your own clinical neurologist. They did a workup, and then you come with a diagnosis. But we are finding that in the early stages, you might not know to go to a neurologist. So it might be you have the early symptoms, but you wouldn't really catch that till much later. So our group has implemented this program. We call it a rapid diagnostic program. And we have one of our experienced physician assistant who kind of leads that, and she would take someone. So it is a clinic visit. So it's not a research visit. It is a clinic visit. But she would assess, your memory. And the beauty of that is you wouldn't have to wait for the long, 6 months or 1 year wait list for a neurologist. And she's a neurologist physician, like a neurology physician assistant. So she is focused on, specializes in memory disorders. So that, and then the idea is if she's able to kind of see if you are interested in research, and she would assess whether there's a good study that would be a good fit from that assessment that you would have.
So is that done? I'm sorry. Is that done initially? That meeting or whatever you might call it with the neuropsych assistant before even meeting with someone who's doing the research or clinical program?
Correct.
Okay.
And the nice thing is that we are in the same location, actually just right down the hall. So we've had it where someone had that rapid diagnostic appointment, and then she's able to send them down our way to have one of our team talk to them more about what we have available. So we are trying to kind of provide that support, recognizing that a lot of times you don't go to the neurologist until it's you're kind of far along.
A participant asks, I am curious about research studies relating to specifically hereditary factors. My mother recently passed after a very difficult several years of advanced dementia, and I am worried about my own path down the road for the next few years.
Yeah, we do have, so there's two types of kind of familial connection with Alzheimer's. So the one that's more mild is if you have a parent or a grandparent that has had Alzheimer's, you do have a higher chance of getting Alzheimer's down the line. And then the other kind of hereditary Alzheimer's that we look at is the dominantly inherited Alzheimer's, where if your parent has this one gene, you kind of have a 50% chance of getting it, which is a large percentage. So we do have a specific study just for that, where they track all family members. They track even the children who are not even close to Alzheimer's age. So that is ongoing, and that's a national study. And I'm not sure from this context if that is kind of the hereditary Alzheimer's that you're looking at. Otherwise, for the rest of our studies, it's not necessarily a requirement or an exclusionary criteria, but if you do have family history, we note that, and that's what they take into consideration when they're analyzing all of the memory testing or any of the scans. So I hope that answered the question. So it's not, the hereditary isn't something we're specifically looking at unless it's this dominant one, this dominant inherited Alzheimer's. But it definitely is important information for us to document and take into account when we're analyzing everything.
A question about placebos, unless someone else has a question right now. Why do some studies have placebos and others don't? And what are my chances of getting a placebo in a trial?
Yeah, I can answer that. So some studies, at least in the Alzheimer's field, don't have placebo, and these are called open label. So that's when you know for sure that you're on the medication. And for our studies, you're not able to kind of get onto that study until you have already completed the double blind, where you've already been through the phase of not knowing whether you're on the active or placebo medication. And I think the only studies out there that skip that are like cancer studies where safety and kind of mortality is in question. But for all other studies to get to the open label, you do need to complete the double blind portion first. And the chances for placebo is often 1-to-1, where there's one group that's placebo and one group is active drug. Yeah, Art has heard this spiel many times, but we do. Sorry.
And I've been through it too. I've experienced it.
Right, Art's on at the point where he's completed our double blind study, and he is now getting the real drug, and he knows that, and we know that. And then, so we do have some studies that have multiple groups. So there's like a placebo group, a lower dose, and a higher dose. So those are still evenly split, but then for that example, you would have 2 out of 3 chances to be on the medication. So there are some that, split different doses to be the active drug.
So our participant said, a basic question, please. Is memory loss always associated with Alzheimer's disease, or vice versa, or not at all?
That's a great question. So the first direction, sorry, is it memory? Can you repeat that?
Is memory loss always associated with Alzheimer's disease?
No, so there are kind of, we call them atypical variants of Alzheimer's disease, where the memory loss actually doesn't come till much later. Sometimes it starts with like behavioral symptoms. Maybe someone's personality might change more, but your memory is intact. Sometimes there's visual variants where you do have issues with kind of perceiving things, but it's also Alzheimer's. And then the memory hits later. And then I haven't seen anything with auditory, but so no, it's not. But the most common is that it presents as memory loss first. And then vice versa, whether, sorry.
So is Alzheimer's disease always associated with memory? Now I'm getting mixed up myself.
Or does Alzheimer's disease always result in memory loss?
I think is memory loss, is it always Alzheimer's disease if you have?
Oh, I see.
Yeah, sorry.
No, memory loss is not always Alzheimer's disease as well. And I think that's where it kind of goes back to not just having a lot of unknown in the Alzheimer's field, there's a lot of unknown in the brain. So memory loss can also be from, earlier we were talking about stress, anxiety, depression, that can manifest in that way too. And that's why for Alzheimer's, they often are pairing them with PET scans now, because this is the scan that we're able to see the amyloid or the tau protein that's associated with Alzheimer's. And a lot of the studies that we're looking at, if you don't have these proteins, then it's likely that it might not be due to Alzheimer's. And then so that's kind of where we tie in to make sure that the memory loss that we're trying to observe or research is due to Alzheimer's. And if it's not, we would, we are connected with like either our clinic at the Brigham or clinic at Mass General to kind of refer you to other neurologists if you do want to follow up within our group to kind of see if there are other underlying causes. So, even like Parkinson's can contribute, can be the reason for memory loss, a lot of other neurological diseases.
A question about my rights as a research participant. What are my rights as a participant, and how am I protected?
Yeah, you are definitely protected by a lot of like processes that we have in place. So first and foremost is before we can even run any study, whether it's clinical trial or observational, we have to get it approved by our Institutional Review Board, or IRB. So they're a third party group that is looking out for the study participants and making sure that what is proposed is safe and makes sense. There's no unnecessary procedures or something like that. So before the study can actually be active, they are reviewed first by, and that includes a panel of physicians, there's radiologists on those panels before we can even run the study. And once we are running the study, it's you have the right to know about all the details, and that's why the informed consent form is such an important document, because that's where we put everything that we know about what is going to be involved in these studies, and you have the opportunity to read that through in detail, not like any of those kind of terms and conditions that you might see on the web where you just click accept and you don't really read it. So for our process, we go through line by line to make sure you really do understand what's part of the study. And, if you need more time to think about it and read it through yourself without our physicians, that's your right as well before you actually decide to join us in any of our studies. And once you do join us, you have the right to, like I said before, it's to kind of stop at any point too if it doesn't work out for you anymore. And you have the right to kind of ask any questions about risks, about any other, if it's a multi-center study, if there's any other research that's been presented out there from other sites, and then how you're protected is all of our studies do have study physicians on them, so we're always looking at even your memory testing to make sure if there's anything abnormal, we would let you know and notify your clinical team, whether that be your PCP or a neurologist if you have one, to kind of follow up as necessary. And if we do collect labs or something like that, and it's abnormal, we let you know that too, and make sure that you're followed up on appropriately.
And a general question, what is expected of me in a clinical trial? And also, what is expected of me in an observational trial?
They're pretty similar in terms of, just being willing to answer our questions when we ask them, to kind of, a lot of our studies do have like specific timeframes that visits have to happen in. For example, like the study that ARTS, and they are monthly visits, and try to figure, we try to be as flexible as we can within the restrictions of the study. We do have some wiggle room where even if they're monthly visits, we have a wiggle room at plus or minus 10 days, I believe. So kind of be able to meet those kind of like study timelines, and being willing to, if there's like MRIs in the study, to undergo MRIs, which I know can be a stressful procedure for anyone who's a little claustrophobic, but we do have options for that as well, and to kind of, I think, keep a big thing is keeping the study team in the loop about anything. We understand there's other things in your lives besides research. So, you know, things come up, we can totally work with you. And we have a good team that, you know, really keeps close connection with our participants. Like I'm sure Art speaks to our study coordinator, Kirsten, like on a weekly basis, you know, and, you know, we definitely try to, so, you know, just communicate if there's anything that might deviate from what the normal participation would be like.
Do either of the studies, the observational or the clinical, require or use a study partner?
Yeah, I wouldn't say all, but I would say most of them do, and that's because to assess memory concerns or even if not memory concerns, kind of daily function of living, it is important to have that kind of second perspective to kind of see how you are at home. And if it's not someone that lives with you, at least has enough of a like correspondence with you to know how you're doing, and to be able to answer about that. So it's kind of like a corroborator for the information, because we do have a set of data that we collect through the memory testing, and then the set of data that we collect from like report from outside, kind of. So, but for some of our observational studies, they don't require it, but definitely for all of our clinical trials, and for some of the observational studies that kind of try to mimic the the clinical trials in order to have that comparison, do require a study partner. But that doesn't mean they have to come in every visit, though.
Right.
Yeah, because not every, yeah, I don't think Art would he did. But because testing is not every visit, you know, so questionnaires is not every visit. So whenever the study partner is needed, then we'll contact them. And the nice thing with COVID actually is a lot of the study design, or like the sponsors and pharma companies that design these studies, are finally adapting and allowing, you know, remote ones. So we've been able to do a lot of our not making, before we had to make everyone come into the site, but a lot of the times, you know, we can do these questionnaires over the phone. So the study partner might not even have to come in if that's an issue.
I might add, currently, it's not just that, they're even offering to do infusions in your house if that's part of a study that you're in. If you prefer to do it at home during this period.
Yeah, because we know we're located in not the best place to commute to, and we definitely, as the study allows, we try to do the home infusion or home questionnaires when we can.
Can you clarify one point for me when you were
Right.
talking about MRI or PET scans,
Mhm.
that if they show anything with the amyloid or the tau, which obviously indicates that it's some form of Alzheimer's, does that person then leave the study and join a different study that really focuses more on the Alzheimer's?
Yeah, so that's a good question. So the different, I can backtrack a little bit. So the difference between MRI and PET scans is MRIs look at the structure of the brain. So I always compare it to kind of like an X-ray. So we're just like looking at what it looks like structurally. And then the PET scan is where we can, that's where we can see atrophy or kind of like shrinkage of the brain. PET scans is what is important in Alzheimer's research, because that's where we can see the protein, where it will light up whether you have the amyloid or tau. So for a study that does require having a quote positive amyloid PET scan, if you have the positive scan, you're in. If you happen to have a negative scan, you would be excluded because that's what that study is looking for. This is just one example. And then we would look at what other studies we have available that don't require that positive PET scan, because not everyone does. And it doesn't necessarily mean that you don't have Alzheimer's or that you won't develop Alzheimer's, because it does take some time for that protein to develop. But then, you know, if you are still interested in research with us, we would be able to connect you with other likely observational studies. It likely wouldn't be another clinical trial, because the whole point of these medications are to decrease those proteins. So if you don't have it, it wouldn't be targeting anything. So if you do have a negative PET scan, we would then kind of refer you to other observational studies if you're interested in research. And then in terms of, like, you were asking whether you'd be kind of funneled into another study that would focus more on Alzheimer's or something. The thing with PET scans is that we are blinded to kind of like what level it is. We only get a positive or negative. So for that reason, we wouldn't be able, like, we wouldn't know if there's like a higher level of amyloid where we would kind of send you to another study. Does that make sense?
Thanks.
That was a good question.
I think we are out of time. I know you only committed to 45 minutes, and I don't want to take more of your time, Art and Nicole, but I want to thank you for joining us. And Nancy, did you want to just add a few
Yeah.
closing statements?
I just wanted to thank everybody for joining us. It's really exciting. The Newton Senior Center is the first senior center to do this roadmap series virtually. So kudos to all of you. There are 2 more events in this series next month and the following month. So next, it's actually Wednesday, the first Wednesday of April will be April 7th. And we will have Roadmap to Caregiving. Judy Johansson will speak, and she is an amazing speaker. So I hope you will all join us for that. And then the one in May is Roadmap to Prevention. And Dr. Seth Gale will be speaking at that one, and that is Wednesday, May 5th. And he is also a wonderful speaker. But today I want to thank Nicole and Art for their wonderful, lively presentations. You guys did a great job, and thank you all for joining us.
Sweet, everyone. And for anyone interested in the more exercise and diet, Dr. Gale is a good one to ask. So he's the one that I know for sure has been running that study. I'm not sure if it's active now, but he would have more insight on kind of diet, exercise, and memory. So I would attend that one if you're interested.
And I have also put my phone number in the chat. If anybody has any questions, needs anything, just give me a call and I will call you back, because it actually rings at work and I'm working remotely, but I'll be back in touch with you. So if anything comes up, you need any kind of assistance, we're here to help.
Thank you so much. And Nicole,
Thank you. See you next month.
I will send contact information.
Okay,
Someone is
great.
asking for your phone number, Nicole. So we'll send that out by email.
Thank you.
Thank you. Stay safe, everybody.
Yep.
Hope to
Bye-bye.
see you next month. Thanks, Nancy. Thank you, Art. Thank you, Nicole.